kidneys are two bean-shaped organs located in the lower back on either side of the spine. Under normal conditions, the kidneys maintain the balance of fluids and electrolytes, but above all they filter the blood, removing waste substances from the body through the production of urine. However, when the kidneys begin to no longer function properly, as in the case of severe renal failure, they lose their ability to filter the blood. As a result, a dangerous amount of fluids and waste substances accumulates in the body, which without timely treatment can be fatal. This is where a life-saving therapy comes into play, dialysis. But how exactly does this medical therapy work? Let's take a look. Introduced in the mid-1940s, but becoming common practice in the 1960s, the invention of dialysis is attributed to Willem Johan Kolff, a Dutch-born American physician and one of the leading figures in biomedical engineering. There are two main types of dialysis: hemodialysis or extracorporeal dialysis, and peritoneal dialysis or intracorporeal dialysis. Hemodialysis is a medical treatment that filters the blood outside the body using a special machine, commonly known as an artificial kidney. The patient is first seated in a chair or placed on a bed. A vascular access is then created, the point through which the patient's blood can be removed and returned during the hemodialysis session. The main types of vascular access include the arteriovenous fistula and the central venous catheter. In the first case, a direct surgical connection is created between an artery and a vein, usually in the patient's arm, to ensure a sufficiently fast and stable blood flow for hemodialysis. The time between surgery and the first use of the fistula allows for maturation, during which the vein increases in diameter and becomes arterialized, making needle insertion easier. In the case of a central venous catheter, a long, thin tube made of biocompatible synthetic material is inserted into one of the central veins, such as the internal jugular or the femoral vein. Compared to the arteriovenous fistula, it can be used immediately but carries a higher risk of infections and thrombosis. Once the vascular access is prepared, the patient is connected to the hemodialysis machine. The blood is drawn by the machine through a pump and introduced into the circuit, which pushes it toward the dialyzer. This is an artificial filter divided into two compartments separated by a semi-permeable membrane. In the first compartment flows the patient's blood to be purified, while in the second flows the dialysis fluid. Also known as dialysate, it is a saline solution containing ultra-pure water, glucose, and mineral salts in varying concentrations, such as sodium, potassium, calcium, and magnesium. Because of the difference in concentration between the two compartments, molecules move from the area of higher concentration to the area of lower concentration until equilibrium is reached. Waste molecules in the blood, such as urea and creatinine, cross the semi-permeable membrane and pass into the dialysate, while at the same time, the blood receives substances needed to correct electrolyte imbalances, such as bicarbonate and calcium. The membrane, which contains thousands of very small pores, is able to retain larger molecules such as proteins and blood cells, including red blood cells, white blood cells, and platelets. During the entire dialysis process, heparin, an anticoagulant drug, is usually administered through a pump to prevent blood from clotting inside the dialyzer circuit. Since one of the kidney's main functions is to remove excess fluids, in patients with chronic renal failure this function is impaired because urine output is extremely reduced or absent. Dialysis can remove waste substances and restore the body's electrolyte and acid-base balance, but to remove excess body fluids, ultrafiltration is used. This can be performed during the hemodialysis session or as a separate treatment. Once the blood has been purified inside the dialyzer, it is returned to the patient's bloodstream through the vascular access. This process continues throughout the session, during which the machine pumps about 300 milliliters of blood per minute through the filter. A hemodialysis session lasts about 4 hours and must be repeated 3 times a week. In peritoneal dialysis, the purification principle is similar, but instead of using an artificial membrane, the peritoneum is used. The peritoneum is a thin, transparent serous membrane that lines the inner walls of the abdominal and pelvic cavities and covers most of the organs within them. In peritoneal dialysis, the dialysis fluid is infused into the peritoneal cavity through a catheter. An exchange of solutes then takes place between the blood flowing through the peritoneal capillaries and the dialysis fluid inside the cavity. In conclusion, dialysis is an extremely important treatment for patients with chronic renal failure, a life-saving therapy that partially replaces kidney function. However, dialysis cannot replace the hormonal function of the kidneys, making replacement drug therapy necessary. Although dialysis is not a cure, it can prolong the patient's life while waiting for a kidney donor for transplantation.